just doing the territorial acknowledgement. So as we're taking this time out to think about the traditional lands of our Indigenous neighbors, I like to do a mental exercise sometime. I bet some of you do too, that, you know, when they've built a new overpass or like the Stony Trail extension or something, like within the week of that coming to be, I can no longer remember what it used to look like how did I used to turn left here, you know, what used to be here in terms of trees and things like that. And it just makes me realize how hard it is to then imagine what was our territory like, you know, 50 years ago, 100 years ago, 200 years ago, you know, hills and trees before all the built environment, you know, what was there before the university, what was on the land before the Glenmore Reservoir. So just an interesting mental exercise about the lands that. Anyway, on to the next slide. I want to remind people of the Institute's new strategic plan, probably too small here for you to see it, but if you go to the next slide, I'm thinking this opportunity, especially the priority announcement part, really aligns with the digital health under better healthcare, digital health, but there's probably lots of other good alignments here, and that's why, and the overall topic with our mission of improving public health research excellence is totally, you know, bullseye for this funding opportunity. So that's why I wanted to get you all together to make sure that we have some good quality applications going forward and, you know, building new teams, new collaborations, whatever it takes to optimize this opportunity. So I think it's over to you, Adam, next, and you're taking over now. Yes, thank you very much.
That's correct. Yeah, I'll be stepping in here. As a brief introduction, because I'll be a new face to a lot of you today, my name's Adam Kirkby. Although I'm a new face, in this capacity, I've been around the university for 8 years. I completed my master's degree here. And prior to this position, I was working as a research advisor in the Faculty of Kinesiology until October of last year, where I was offered a position by Jenna in the Office of Grant Development and Research Facilitation as a Grant Development Officer. And a lot of the work that we do is support faculty within the Cummings School of Medicine on the pre-award side of grants. And part of that role, and why I'm here to talk to you today, is that when I find an interesting opportunity that I think faculty would like to hear about, what I like to do is raise some awareness. So the intention of today is to take you through some of the aspects of this new Catalyst grant that's been announced and sort of build up some interest and get some ideas flowing. Now, throughout the slides that I have presented with you today, I have quite a few links to a lot of the agencies and a lot of like the terms that I use and everything. The idea is that once these slides have been circulated with the faculty, if this is an opportunity you think you'd be interested in, all the resources are there for you to explore in your own time. Now, to get into it, this funding opportunity stems from the Chief Public Health Officer of Canada, who provides the Minister of Health with a report every year. This year, the report has highlighted a collective vision for some of the opportunities that can be used to renew and strengthen the public health care system. So to help aid that, there has been some money put forwards to help get this opportunity going and of interest to the faculty. Based on the strategic objectives that we saw on the last slide, I think that this is going to be of particular interest to you guys in the O'Brien. So the specific objectives of this funding opportunity are to support high quality research, which was aligned with the priorities that were identified in this report, which we do outline later on in the slides. It's also there to strengthen the links between researchers, knowledge users, and decision makers that are involved in decision-making on key public health issues. And finally, it's also here to strengthen capacity to generate and apply context-specific knowledge in order to build more effective and equitable public health systems. Now, I have some key information for you in this slide. So although we don't have the competition yet in the University of Calgary funding deadline calendar, we do have an agency deadline, and this competition will be running through an internal process, our RMS system, which I imagine a lot of you will be familiar with by now. Usually the RMS system sets a deadline 3 business days before the agency deadline, which means that we can expect this deadline to be about April 29th. However, this is yet to be confirmed, So it may shift by a day or two, but we are expecting the final deadline to be April 29th. As for money and cash available, the brass tacks of it is that there's $2 million on the table. The idea is that how they're going to divide this up is into 20 grants, which will be used as about for each grant 100,000 per year for 1 year. This 2 million is divided into two pools. There is a general pool, and the funds are split 50-50. So there will be 1 million in one pool and $1 million available in the other pool. We have the general pool, which will fund 10 applications, and we have the very catchy title of the Center of Research on Pandemic Preparedness and Health Emergencies pool, which will have its own $1 million. It will support 10 applications. Now, for the early career researchers out there in the audience, I want you to know that in each pool, there is a minimum of 2 grants set aside for ECR applications. So I think that's a great opportunity and more encouragement to get that application in if you have an ECR status. For the mid-career to senior researchers in the audience, the way this works is that if they don't fund any ECR applications, then the money set aside then goes to the highest ranked application from a mid to senior level. All right, as far as allowable costs go, there isn't anything too shocking here. Anybody who's applied for tri-agency funding should be pretty familiar with the use of grants. Essentially, the rule of thumb is that the funds can be used to support the direct costs of research. Under the conditions for funding, though, there is something that I want to draw your attention to, and that's that as part of this award, the applicants are expected to attend at least one knowledge mobilization event. So essentially that means that in your budget, you're expected to attend one of these events, and they expect you to put $2,000 of your budget aside in order to support travel and accommodation and getting to these events. So just keep that in mind when you're thinking about this. Make sure that that's put in reserve. So I want to go into a bit more detail about the 2 different pools that they have available here. It's pretty straightforward when you start to get into the details of it, but it's important. Actually, we are encouraging an open discussion. So I see a hand up from Miles there. If you just want to come off mic, feel free to ask a question.
Sure, thanks, Adam. Just quickly, your previous slide suggested that there was expected to attend at least one knowledge mobilization event. Is that a knowledge mobilization event as defined under the terms of the grant, or you could go to a conference and that is an event?
Well, that's a great question. And the details on exactly what this event is supposed to be are a little lax. What I have here is pretty much what I have access to. All it really says is that the event's going to be designated by the CIHR and Public Health Agency of Canada. But I would be more than happy to look into that and see if I can dig up any information on the specifics.
So
I think that's usually an event that they arrange, right? And they expect you to go to. I think in other funding opportunities like
yes.
Yeah, because it's designated by the CIHR. I think they have plans in mind for you.
You could certainly, Miles, sorry, it's Jenna here just jumping in. If there's other conferences or events that you're wanting to attend, you could include that, but there's this one that they are specifically going to expect you to attend, so you must budget for it.
Yep. So it's not sort of at least one knowledge mobilization event. It's you must attend our knowledge mobilization event, and you can do other stuff if you'd like. Gotcha. Thanks.
Okay. So yes, about these the pools that I was breaking down into. Okay, so you have the general pool. As you can see here, there was this CPHO annual report that I referenced before. Now, for those of you who are interested in reading it, I do have a link here, and you can go through the whole document. But as a heads up, it is a very extensive document. It will take you some time to read through. And when you read through it all, they essentially boil down the areas of improvement to these 4 bullet points here. So when you're looking at the general pool, you're expected to be applying to one of these key target areas, which is fostering excellence in public health workforce, improving our tools, modernizing our models of governance, and ensuring stable and consistent funding. If you'd like to go into any more details or specifics within the report, at the bottom, they have about a page where they expand on exactly what they mean. So if you feel like you have an idea that might fit into one of these, but you're not entirely sure, I encourage you to go check the report and you'll find more details. Now, as for the CRPPHE pool, this one is, how to put this, quite similar to the general pool. I think there's a lot of overlap between them. However, I would describe this as having a more specific set of criteria. So chances are, if you have a project in mind which you feel fits for the CRPPHE pool, it's probably also going to fall within the criteria of the general pool, but you're encouraged to go for this because it will be more specific. For those of you who are reading the first bullet point, which is that the idea or the innovation or the research project must align with the CRPPHE mission. For those of you interested, I have a link there, but the mission is essentially to prepare Canadians for exactly, as their name suggests, pandemics and health emergencies. So it's a pretty self-descriptive mission, and chances are if you fall into one of these bullet points down here, which I'll cover shortly, then you also fall in and fit the criteria for their mission. So more specific for this pool, as I said, it's a little bit more specific. They're looking for you to evaluate effectiveness and efficiency of digital health initiatives, identify or evaluate tools and approaches to measure and improve the public health system. We're also looking to leverage foresight tools, develop and or test equity indicators, develop and evaluate policy and program interventions to build trust in public health and decrease impacts of mis and disinformation, measure infectious disease and their impact on First Nations, Inuit and Métis communities with a specific focus on COVID-19. All right. Now, who can go for this award? I want to talk a little bit about the eligibility a little bit. I'm just going to take a little quick sip of water. All right, so if you're considering this application, then there are three criteria that you need to, well, one of the three criteria that you need to fit into to be considered an NPA. You need to be either an independent researcher or knowledge user affiliated with a Canadian post-secondary institution. As I mentioned before, there are funds set aside for ECR. And I think that it's important to note here that recently the CIHR has extended what they consider to be an early career researcher to 84 months. The previous definition that they used was 60 months. That's now been extended. So if you feel you were just cut out of the ECR status, maybe have a little look into it again. You might qualify when you didn't expect to. Okay, other people who could be considered an NPA are people affiliated with an Indigenous non-government organization in Canada with a research and or knowledge translation mandate, or an Indigenous non-government organization in Canada with a research and knowledge translation mandate. All right, so once you've identified your nominated principal applicant, it's also important to remember that you need to do the sex and gender-based analysis online training modules the CIHR offers, which is important for all their applications now. And then for any research involving Indigenous populations, this funding opportunity seeks applicants who self-identify as Indigenous or applicants who demonstrate their experience working in Indigenous health research environments. Now, interestingly, for this application, this isn't always the case, but there is no limit to the number of applications an applicant can submit or be a part of, which I think is a cool detail. So looking at the application process as a whole, I've identified basically 8 tasks or 8 components to a full application package. Now, I do want to clarify at this stage that this competition will be running through an internal submission process, which I mentioned earlier in the presentation. So it will be going through RMS. I imagine many of you at this stage are familiar with what RMS is and how to use it. However, if this is a new term for you or you'd like anything clarified, this right here is a link. It will take you to the homepage and you can read more information on what it is and how to use it. So with that being said, the first thing that you have to do is identify your participants. And once you have your team together, it's important to note that all participants are required to submit a CV. Now, if you are a Canadian academic, then you're expected to submit a CIHR BioSketch CV using the CCV interface. If, however, you are Indigenous or a non-academic, you can still apply and you have the choice between either a CIHR biosketch or an applicant profile CV. And let's see. Yes, MPA categories with Indigenous-led non-government organization as an eligibility requirement must include their applicant profile CV. All right, so for the proposal itself, if you're intending to write the proposal in English, which I imagine many of you are, then you have 5 pages set as your limit. However, the CIHR will also accept proposals written in French. And then if you are writing in French, you're allowed 6 pages to complete your application. You're also expected to include a summary of research proposal and also enter your budget information. A budget justification must be provided as a free-form attachment. And also, just to really hammer this home, you are expected to outline the $2,000 that we previously discussed for your knowledge mobilization event. I say your, I mean the CIHR's mobilization event. All right, and then as far as other tasks are concerned, we have the last 4 here. There are other application materials that are expected to be attached. I mentioned before the sex and gender module. Now, I have noticed every now and again with the RMS applications, it's not always clear where you should include that information. And sometimes it gets missed out and needs to be attached on a later date. The appropriate place for this is under the other documents where they're expecting to see your sex and gender module attached there. You can also include things such as the Indigenous experience, name and organization. If you're working with these communities, they're expected to be there too. And you're also allowed to include 1 page, which is going to be covering how COVID-19 has impacted the teams. All right, you also have the option of including peer review administration information. You are expected to apply for the funding pools that I referenced before. You have to state which one you're going for. And then finally, you have to upload your signature page. And with that, you have the main components that's going to go into one of these applications. Now, once your application's in, I wanted to cover a little bit about what the CIHR is going to be looking for in your application. So essentially, there are 3 areas that they're going to be looking for. They're going to be looking into what you've written down and what you're proposing in the research methods that you've used. They're also going to be looking at your team and who's actually on this grant. They're going to be looking at their experience and qualifications. They're going to be looking at the appropriateness of the team. And if you are involving First Nations, Inuit, or Métis people, they're also going to be looking at the extent of knowledge and experience that you actually have working with these people. And then finally, they're going to be looking at the impact of the research. And this focuses on sort of like the value and long-term value that your research is proposing to offer. They're going to be looking at the contribution to the improvement of the public health outcomes and the appropriateness and adequacy of the proposed knowledge mobilization plan. So essentially what they're just doing here is just making sure that what you're doing has some long-reaching outcomes and fitting to the criteria of the program. So with that said, as I mentioned at the start of the lecture, our office does a lot of support for faculty within the Cummings School of Medicine. So I'd encourage you, if you have any questions, or if you would like a review of anything that you've written up, or just any support in general, feel free to reach out to me at any time at this email. And I've also included a link to the ResearchNet opportunity for your information. And with that, I think we can move on to the discussion portion.
Exactly. So yeah, this is the part where we open it up and we want to hear, do people have thoughts already of how they want projects they want to put forward? Are do you have gaps in expertise where you're looking for collaborations? Are there a few people that are thinking of the same kind of thing that might think of rolling together? As Adam mentioned, can you envision, are there certain kind of support things that you'd like either from their office or from the O'Brien Institute, other than, you can say this will definitely be open for regular IPR. So look on, the IPR registration site if you're going to want to do that. But so, yeah, turn on your cameras if you want. And hands or chat or whatever you want to discuss next. I see one of the questions right at the very beginning. I'm not sure if it's now been answered by Adam's question was, is there where is it again? Is there any, are there specific areas under the general pool? And I think not, right?
Say that again. Sorry, can you repeat the question there?
The question was, are there specific areas under the general pool?
Mostly they're looking for, I can pull up the 4 bullet points again, but they're looking for you to respond to one of those things. Let's see, where are my stuff? There they are. So for the general pool, they're really looking for you to identify and address one of these 4 bullet points here.
Okay, and then Amity asks for the funding opportunity objectives. Can they go in the chat, or do you just want to see that slide again, Amity? Either is okay. Pretty sure you must have a slide about that, Adam.
I did right at the start, the objectives.
But if you go to the actual report, it lists some other specific priorities. Can you link there?
Oh.
Because those are pretty specific and they weren't on any of the slides.
I
So
apologize.
that was Dana. Hi, Dana. So you're saying under the CPHO annual report or the funding call that lists others?
In the actual annual report, there was more specific priorities there that I didn't see on any of the slides that were shown.
Are you working on that, Adam? And then I'll ask Liz the question about, do we want to turn off the recording during the questions, the Q&A?
Completely
That
up to you and Adam. If we want to stop recording, maybe that will generate more open discussion. We can pause the recording. Yeah.
Let's do that. And then if we come up with things that are, less of a discussion and more of a, aha, we learned something that wasn't in the discussion by having the, that can go in, Adam's FAQ section or whatever ends up getting 4 hours or whatever and getting put on the web. So
I can pause the recording, and Miles and Lindsay have questions as well.